Stay with the story. The National Education, Health and Allied Workers Union wants an immediate investigation into the fire at the Charlotte Maxeke Academic Hospital. Personal protective gear, as you would have heard from Mangoba, has been damaged, while patients, of course, are being moved to other facilities such as Baragwanath, which, of course, is also one of the province's COVID-19 centers temporarily closing. That's Charlotte Maxeke. Now, I'm joined via Zoom by Clement Marule, who is Nehawu's provincial coordinator. A very good afternoon to you, Clement. Thank you so much for your time and thank you for your patience. Does the union believe the department will handle the patients and their transfers adequately?
No, thank you very much, and thank you for the opportunity. Yes, we believe that they will be able to deal with the situation as soon as possible.
Okay, we seem to have lost
to stay that particular hospital.
All right, so Clement, I don't know if you can hear us.
Yes, I can hear you.
Okay, fantastic. We had just lost your audio just briefly there. So, Clement, what is the union hoping to see being done? What kind of answers are you looking for as you're calling for an investigation?
The investigation should be really based on the cause of the fire. That's why we're saying let it be done as soon as possible, so that we get to the bottom of the cause of the fire. So that we really have to speedily normalize that particular hospital, because we are at the period where the third wave is threatening. So we can't afford to have that particular hospital closed for a longer period than a week.
But are you satisfied, though, with the work that is being done by the hospital, the CEO, the department itself? Of course, the Premier there showing up quite quickly and giving out necessary answers that seemingly show that everything is under control. Is Nehawu satisfied with the way things have been done in the last days also?
Yes, we are confident. Before coming to this interaction with yourself, we've been in discussion with the office of the MEC, who have just assured us that they are hands-on. Then they have also briefed us about what they have been doing from yesterday, evacuating patients and so on. And we are very much confident, also with the help of our members and workers in that particular hospital, who have put who have been dating their hands to make sure that really the situation get to be sorted out. So we're confident. As they were also saying to us that it is a week closure, but they are looking forward to open it sooner than Friday. So we're very confident that really they are on course to clear up that particular situation.
Ndati Marule, you obviously mentioned that it cannot be closed for longer than 7 days, given that it is one of the hospitals dealing with this pandemic, and one of the bigger hospitals in the province dealing with this pandemic. Do you believe that the other institutions and other facilities have the capacity to take in the number of patients that are coming out of Charlotte Maxeke?
Obviously, this is unplanned. So even if they were to be having capacity, but this is something unplanned, they will be under serious stress for this particular 7 days or so. So even if they are having capacity, but with this particular incident, they are going to be finding themselves under serious stress. So that's why we are calling on the department really to expedite the intervention, so that we take stress out of those particular facilities that they are assisting currently.
Of course, Mr. Marule, you did say earlier on that you had an engagement with the MEC just before you spoke to eNCA. Have you had an engagement with some of your members who were at Charlotte Maxeke? How are they feeling?
We have not been able to speak directly to our shop stewards, but we've been talking to our region where the hospital is located. That they have assured us that our members are really hands-on in assisting the process, in making sure that the smoke, because the current threat now, it was not a fire per se, because the fire was contained on time. The only thing that was a threat and is still a threat is the smoke. So that's why the department, helped by members and workers, are trying to clean up to deal with the smoke, because it is the threat. So really, these 7 days, it is to deal with the threat of the smoke more than anything.
Just before I let you go, Ndate Marule, just to get your thoughts on the handling of this pandemic, of the health workers in this province by the department. Are you satisfied? Because obviously we've seen over the course of the lockdown over the last couple of months, there were times when health workers at some instances were not happy with their treatment during this pandemic, when they of course are the people in the front lines. Is Nehawu here in the province happy with the way the Gauteng department has dealt with, has handled, has been running the situation where the pandemic is concerned?
Our unhappiness is not really prohibiting the work. So whatever unhappiness, we know where to knock. We've been in engagement with the Premier's office. We've been in engagement with the MEC of Health, so who are constantly, discussing with us, and we are also uploading that particular platform that they are continuing giving us, so that we air all those particular challenges that our frontline workers are facing. So we're not allowing our those challenges to really take our eyes off of the national challenge. So we know how to deal with those particular challenges as we continue dealing with these issues, and we are happy that when the second wave was a threat, we managed to go to the office of the MEC, who assured us, and we've been walking the path with the MEC, with the office of the MEC. When the rollout of the vaccine started, they also consulted with ourselves, and we've been always raising issues at the right platform to make sure that really whatever that we're not satisfied with does not really disrupt this particular, national challenge that we're facing.
Ndate Marule, thank you so much for your time this afternoon. That is Nehawu's Provincial Coordinator, Clement Marule.